Thanks for putting in so much hard work learning these concepts and these exemplars. You're worth it, and I appreciate your time. We're going to be talking about breast cancer, so go ahead and grab a blank exemplar worksheet and your Davis chapter 65, and let's get started. Breast cancer affects tens of thousands of women every year in the US. And although mortality rates are improving, it's still the second leading cause of cancer-related deaths in women. The single greatest risk factor for getting breast cancer is age. Women who are within 80 to 85 are 15 times more likely than women aged 30 to 35 to have breast cancer. This is one of those cancers that's definitely hormone related, and the risk factors for breast cancer vary, and it has a lot to do with the impact of estrogen on the woman's body. So risk factors include higher numbers of ovulatory cycles over their lifetime, a late menarche and late menopause, lack of pregnancies or live childbirths, or any known genetic mutations that might run in their family, predisposing them to be at risk for breast cancer. Cancers are described by their location where they start. So breast cancers start as abnormal mutations of cell growth in the breast tissue. But then those breast cancer cells, those abnormal cells, can get into the bloodstream, into the lymph nodes, into the lymph system, and spread or metastasize to other areas of the body. Remember, this spread is uncontrollable. Those cells can grow forever. They're really hard to kill, and they're easily spread to other areas of tissue. Signs and symptoms typically involve noticing a new mass or lump, either at home during self-evaluation every month of self-palpation, self-checking of breasts, or noticed by a physician or a provider, or the patient or the provider may notice a change in the breast shape or swelling. Diagnosis occurs through mammograms, ultrasounds, MRIs, and biopsies. Typically, a mammogram is the first point of screening, and if any abnormal cells or areas are noticed in the mammogram, patients will go then further for an ultrasound, maybe an MRI, and then the last check to really be sure if this is cancer or not would be some kind of biopsy to harvest some of those cells, put them under a microscope, and see if they're abnormal. As we discussed in our cellular regulation concept from Giddens, breast cancer treatment and management can involve surgery, chemotherapy, and radiation, and the provider, along with the patient, determine the best plan of care for them. There's 3 pharmacology medications you should know about breast cancer, and since breast cancer is a hormone-induced cancer, all 3 of these medications work to suppress estrogen, as estrogen increases breast cancer. So tamoxifen, anastrozole, and medroxyprogesterone all suppress estrogen in the body. Here are 2 examples of surgery that can be had for breast cancer patients. One is a lumpectomy, only taking out a small portion of the breast, and the other is a mastectomy, taking out the full breast and also some involved lymph nodes. And here's what a patient would look like after they had a bilateral mastectomy. Now you can think about the self-image problems and self-esteem issues that patients can undergo having such a significant change in their body image. Many patients will undergo plastic surgery and breast reconstruction to try to regain some of their normal appearance after having breast cancer. Now, treatment for breast cancer, like any cancer, has a number of different complications. Certainly, surgery itself can have those immediate post-operative complications, like wound infection or dehiscence are complications initially, as well as risks for pulmonary embolisms and pneumonia. Once the initial surgery recovery has happened, complications from surgery really stem from the scarring that's involved and the lymph node effects when lymph nodes are removed. Most common long-term effects from a mastectomy are shoulder immobility, pain, and lymphedema. Now, lymphedema or swelling of the lymph area happens because of removal of the axillary lymph nodes that really causes a disruption in the way the lymph drainage happens in the area. And this can lead to swelling in the arm because the lymph is not able to drain appropriately from the arm. Now, chemotherapy has its own side effects, as we've discussed, things like weight loss, anorexia, fatigue, loss of hair loss, decreased white count that puts the patient at high risk for infection. And so complication from cancer in general can be that the patient gets a secondary infection. And then radiation has its own possible side effect, including a burning sensation or some swelling or discoloration where the radiation happens. So here's an example of lymphedema. You can see the swelling in the arm. It's because that scar tissue blocks the flow of lymph fluid back to the heart. You want to make sure in breast cancer survivors that we're not doing any blood pressure checks on that arm because we don't want to mess with the return of lymph fluid back to the heart. So let's talk about the nursing process as it relates to caring for the patient with breast cancer. Let's start with the first process of ADPI assessments. Assessments and care are dependent on the point and the time of diagnosis and treatment. Certainly someone who's just being diagnosed or maybe undergoing their yearly mammogram is going to have different needs, both physiologic and psychosocial, than someone who's, for example, an acute patient in stage 4 breast cancer postoperatively. Nursing diagnoses or problems that we can resolve are going to include things like pain or discomfort, a risk for infection, altered nutrition having to do with the anorexia, and body image disturbance, especially when surgery is involved. Our nursing interventions, when we think of interventions in our Davis book, they always talk about 3 things: assessments, actions, and teaching. So let's get into those now. For our assessments, we're going to assess vital signs, pain, daily weights, INOs, evaluating the wounds, and monitoring lab data. Our actions are going to be giving medications as prescribed, encouraging coughing and deep breathing postoperatively, providing appropriate wound care, and encouraging the patient to talk about their experience using those therapeutic communication techniques we've learned. And when we teach, we want to teach and explain the treatment course, what the patient can expect throughout the course of their recovery, what medications and treatment side effects they can expect, any wound care that the patient might need to continue doing at home, counseling for nutrition to make sure that they have adequate intake, and encouraging the patient to attend support groups for the psychosocial support needed for both them and their loved ones. Evaluation, how do we know if we're doing good care for these breast cancer patients? Well, we want to evaluate their and manage their nausea and vomiting. How are they doing with their weight and nutrition status? What's the surgical site look like? Is it approximated? Is it clean and dry? Is it healing well? Are we able to minimize scarring and lymphedema after a mastectomy? And how is the patient coping with the stress and the anxiety and the depression that can happen with cancer? That's going to do it for our chat about breast cancer care. I hope what you're seeing is that once you have an understanding of cellular regulation as a big nursing concept, it's really easy to apply what we know of that to these specific types of cancers. Thanks for listening, and we'll see you in class.